Dr. Jonathan Tripp joining me in studio. He had a little surgery done on the top of his head. It's
Only the hair part. That's
your
right.
wife. She's got some skill there.
I know. She's the mother, office manager, fixer of all things, daughter of a plumber.
She could
So,
put a little barber pole outside the shop because at one time, right in history, barbers were doctors.
yeah, barbers were actually the way it was distinguished is there was the guild in the British area was barbers and surgeons. And doctors were considered medical doctors. And so you'd have a surgeon that went through totally different training, learned how to cut on things, shave people. And so they were the operators, but not necessarily the doctors. Now we combine the training as one and the same, and then you branch off as to being a surgeon versus family medicine, internal medicine specialist like cardiologist, gastroenterologist.
In fact, I had a dentist one time, and he told me that his medical school, he said that the first 2 years of training were the same as any medical doctor, and then they would branch off and go into dentistry,
Uh,
which I guess is
I,
probably not uncommon in some
I
parts of the
I
world.
think that's pretty true. I never went to dental school, so I can't tell you the exact differences. But I'm sure a lot of the basic sciences are nearly identical because, and I guess what's different about the training I came away with is emphasized over and over and over during our coursework was you have to treat the body as a whole, whereas a lot of the MD programs, a lot of the, I'm sure, dentistry programs, you learn about the different systems of the body, but pretty much you're focused on what
Mhm.
you're going to focus on.
In fact, I remember hearing that if you have an issue with bleeding gums, it can actually be a sign of heart trouble or will play a role in heart trouble in your life.
Yeah, and we've learned a lot about gum disease being directly related to increased incidence of heart disease or diabetes. So, you know, dentistry has a very important role to play in general health.
You wanted to continue this week what we were talking about last week, and that was you were just taking some general questions from the public at large about what might be troubling them.
Yeah, with
Uh,
this, we had a lot of fun, and I think we had even three callers still waiting on the line when we ended the show last time. So I thought this is one of those times that let's just play it again. Back by popular demand, we'll take call-ins and kind of whatever is on your mind. I can start out with what's been fun for me this past week: back pain.
ooh, that's been your own issue.
Yeah, it is my own issue. I have a lot of personal understanding of what back pain's about and how to get out of it. And so I have a bulging disc that showed up about a year and a half ago and completely debilitated me for several weeks. In fact, I had no moment in my day or night that I was out of pain for about 3 weeks of very intense pain until I found the swimming pool and I had my first 20 minutes of no pain. And I'll tell you what, I was motivated to go back. And for about 3 months straight, I was in the pool every day. And so that's a big push I give when people come in and tell me about, oh, my back hurts or this or that. And now this past week, I had uh, no particular accident. I've been doing a lot with exercise. And so I probably pushed too much in one direction or found out I was all impressed how flexible I was getting, and I probably got pushed a little bit too much for that flexibility. But over the course of one day, it just started out slow, got really bad. By the end of the day, I did do massage, so I'm a promoter of somebody getting massage. But the next morning, I was in the pool probably for about 40 minutes, and that's a long time for me to be in the pool. But by the end of that second day, I was already feeling as good as I usually do a week later. So getting that buoyancy, getting the weight off, allowing things to relax, lets them reset a lot. And then, I don't do crazy stuff when my back hurts. So, well, I don't know. Today I worked out again, and you'd say I was crazy, but it's going well.
That swimming, though, like bicycling, it's a lot easier on your joints than, let's say, running would be.
Yeah, yeah. The impact on joints is tough. I've been blessed with good joints, and so even at the ripe old age of 32, maybe I'm a little older than that. Um, my knees don't bother me when I run. I don't run far, so I can't speak to those that do marathons. But yeah, I've been blessed that way. But when I do have troubles like this back, the pool is just completely takes all of that impact out. You get all of the motion, all of the relaxation of the muscles, and you get a major workout if you're swimming.
Some of those guys who go out into the desert and they run hundreds of miles, over a course of a few days. I mean, they're running all day long, but they have special shoes for that. It's a
Yes and no. What's really interesting is there's a book called Born to Run. I think it's about 10 years old, but it talks about a guy who was 6'4" and wanted to be a runner and always had injuries and actually wrote for one of the runners magazines and went and spent some time with the kind of you'd say Native American peoples of the northern part of Mexico and Copper Canyon area, and they as a people run. Um, and so and it's not just the men, it's not just the adults, it's all of them. And for the most part, what they found is really interesting is that when you're 19 and you run these long distances, you have a certain speed, and about the time you're in your late 20s, you tend to be at the peak of that speed. And what's interesting is you'd think, okay, within a few years after that, you're back down and even slower than the 19-year-old. But they found that those in those tribes, until you're about age 60, you keep up with the 19-year-olds. And so there's our bodies can do a lot if we work at it.
We've got more with Dr. Jonathan Tripp on the way in just a few minutes from Tripp Family Medicine here in Twin Falls. We're at 35 at 840. The doctor was talking about some back pain, and he's taking calls on any medical issue this morning that you may have. This is your opportunity. If you've got something that ails you, to get some advice from somebody in the know. Let me put it this way: his advice on medical issues is far better than mine. It's 8:43. We're at 36. Dr. Jonathan Tripp in studio with me, Bill Colley, and we call it Better Health with Tripp Family Medicine. And remember, life's too short not to feel good. A friend of mine
Exactly.
yesterday went for his third shot in a matter of weeks in his back and his spine. Now, this is a guy who was healthy all of his life. Has not been a heavy drinker by any means. He's not a smoker. A few years back, he jumped out of a van after unloading it, and when
Boom.
he hit the ground, his back hurt. And maybe we can get into that in a couple of minutes, but we have a caller with us right now, and to talk a little bit about how people can deal with that chronic pain.
Sure.
Caller, you're up next. You're on the air with Dr. Jonathan Tripp. Welcome.
Good morning, gentlemen. Hey, I got a question for you. I work a lot with younger people. Lately, and with things that have been in the news, I've heard a lot of compliments talking about all the virtues, extolling the virtues of marijuana. We're talking about pain and pain relief. And, I hear a lot of people say that it can do everything from cure hangnails to diarrhea. Marijuana is just the drug of choice. And to me, it seems like anything you would smoke would have some kind of a bad effect, respiratory or otherwise. I do know there's products out that are made from marijuana that utilize the active ingredients in it that doesn't require smoking. Could you expound on that a little bit? I appreciate it. Thank you.
Yeah, this is a fun topic. I spent a year working in Oregon where medical marijuana was legal, and they had four criteria for what was an actual purpose for marijuana, and probably the main one would be well, the top two for me was to help with nausea in people that had uh, serious cancer, undergoing chemotherapy, and to improve appetite in whether they're an Alzheimer's patient or again cancer related because your appetite gets really killed with the chemotherapy. But interestingly enough, chronic pain, which is the number one reason that people say they're seeking marijuana, is not an indication that marijuana fixes. Yeah, it may dull your senses, but it is not considered to be one of the medical therapies. Now, when I start growing it and start selling it from my office, it will be the therapy of choice for almost anything. But so far, I haven't decided to do that. So, no, I think there's definitely some true benefits. Anybody who's smoked marijuana and gotten high knows about the munchies. They also know about the possibility of some paranoia. So there's good and bad. If you're thinking medically, it really is mostly to help people that are struggling with weight loss that they can't control, whether it's because they don't have the mental capacity to do so or because they're under some other influence that's making them terribly sick. There's a condition called gastroparesis, which really shuts down the motion of the stomach and will make you terribly ill feeling all the time. And so there are some of those conditions that it has a great benefit for. I think there's only one pharmaceutical drug called Marinol, and the problem is it does use THC, which is the main ingredient in it, but it's a $500 a month type of a cost. So, in that point of view, smoking it or baking it in some what they used to call hash brownies, that probably would be a better move or a less costly move than the prescription. So in that case, traditional medicine doesn't meet the need of the person who doesn't have the insurance or can't afford that high cost for the benefit of that.
We have another caller with us. Caller, thank you for your patience. You're up next on KLIX with Better Health.
Yes. About a year and a half ago, I had 2 foot surgeries on my right foot that went bad. The first one left me with a lot of pain. It was a bunion surgery, crooked, the whole bit. Well, I let the doctor do it again, put a plate in it, and since then, I've had nothing but nonstop pain, more so, of course, when I walk. And then my foot went to sleep, and then I have what I call bee sting feeling in my leg from the knee up to the groin area, nonstop. Nighttime gets progressively worse, and just a few days ago, I went and had a cortisone shot, kind of where the leg comes onto the body. The first 3 days, it was wonderful, and then it came back full force, if not worse. What is my problem?
Well, it sounds like the left lower extremity. We should just cut it right off, and then you won't have any problem. No,
Yeah.
you've thought about that, haven't you?
Oh boy, at night when I'm laying there and, no relief, the only thing that helps at all is gabapentin. And I take gabapentin for a chronic cough, even though I've never smoked in my life, but it's a nerve ending type thing.
Okay. No,
So
and the
I've
gabapentin.
increased that.
Yeah, the gabapentin is probably the drug of choice for nerve pain. It does not always work, and it is not perfect, but it helps a lot of people. Another little trick that you could try is over-the-counter niacin.
Oh,
Niacin, if you get the immediate release, guaranteed will give you a hot flash for about 20 or 40 minutes, and
oh,
you'll think you have an allergic reaction. But if you get the extended release, it's usually a 500 milligram tablet or capsule, and you could take 1 or 2 of those a day and just see after a week or 2 if you're getting less of that nerve pain, because what niacin does is dilate blood vessels, and where there's good blood flow, there's less nerve trouble. To address the bigger issues of why you have that bee sting numbness. The foot pain, I think, is pretty obvious, but I don't know how they're connected. But it sounds like this is more of a low back disc or nerve issue that an MRI would probably be what I'd look for. But that's when I need to do a physical exam to tell you really what direction. But at least at a minimum, you could try the niacin for a few weeks. But orthopedic surgery or a spine surgeon sounds like the right direction for you.
yeah. And I've been to, the orthopedic doctor gave me the shot the other day, and then the neurologist is the one that prescribed for me to go to him.
Okay, and the
And talk
shots
about his
that they're
checklist.
doing, was it under a type of X-ray, a moving X-ray called fluoroscopy, or was it?
I think, yeah, it was with a camera type thing.
Okay, so it was a very deep to the spine shot.
Well, it was in the groin area where the leg connects onto the body.
Oh, it sounds like that's more of a ultrasound, but yeah, it sounds like you're in the right direction, but can't tell you specifically what that is over the radio. As
Okay.
smart as I think I am, but thanks for the call.
Thank you, doctor.
Want to thank her too as well. And the telephone number to reach the show, 736-0300. Dr. Jonathan Tripp in studio with us this morning from Tripp Family Medicine, right here in Twin Falls, Idaho, on Fillmore Street, directly across from the main post office. And in fact, a lot of times people tell me they're in the car and they can't, they want to be safe, so they're not on the phone. But if they want to talk to somebody at the office after the program, how do they go about doing that?
Yeah, our phone number is area code 208-933-4400. That's 933-4400. And I have, great nurses that can answer basic questions. Frequently, they're going to ask a few details and then probably recommend we see you, depending on how serious or how long the problem's been going on. Part of what's really nice about our office is if you're sick or you're hurt, we make a great effort to get you in the same day or at least the next day. That's not true if you're calling in because you need refills on a medicine that you've had for 3 years and you haven't gotten around to it. But if you need stitches or your throat's swelling or you've got a rash that showed up and is making you itch all over, we're gonna try to get you in the same day. Um, and you can also reach us on the web at trippfamilymedicine.com, and we're also on Facebook at Tripp Family Medicine. So I'd love to hear from you there. But yeah, we have unusually good staff all the way around. In fact, it's a pleasure to go to work, and we have unusually good patients. So it's a really nice place to be. In fact, it's the nicest office I've ever worked in.
Want to say that I've experienced the same thing when I visited there. That really good people. We have a caller with us. Caller, you're up next, and you're on the air with Dr. Tripp on KLIX.
Yeah, doctor, I've been having some trouble with my ears. Mostly happens in the evening. Watch the TV. I think they call them liberals. Very irritating. Can you help me, Doc?
I can, and it's pretty inexpensive. In fact, there's lots of sportsman type locations you can find earplugs. They do pretty well. Or change the channel. or you can listen to Bill Colley. I think that would probably change that.
I was mentioning my friend Denny who screwed up his back jumping out of a van after unloading it a few years ago, and everything else about him, he's in tip-top condition. But he had some surgery done a few years ago, and for a time, the surgery made him feel better, and then the back pain came back. And as he said, the first 2 shots he had to apparently dull the pain in the last couple of months didn't do the trick. But shot number 3, he went back for yesterday, and he said if it didn't work, he was going back for surgery.
Yeah, the shots we're talking about are frequently referred to as epidural steroids. So women are familiar with the idea of an epidural for anesthesia during childbirth. This is very similar. What it means is that the injection is going into the same area, the same location, which is just next to the spinal cord. And what they're really hoping for is that the steroid will suppress swelling of the disc or swelling of the soft tissues that are pushing on the nerves and give the nerve a little breathing room so that it functions normally and doesn't give this miscommunication of pain all the way down your leg or even weakness. Like in my case, I actually had what's called a foot drop, meaning as I'd walk, I couldn't hold my toes up when I'd step. They would literally flop down on the ground if I tried to walk on my heels. And so that's not because there's a problem at my foot. The problem's way up at the low back. And so those shots try to reduce the swelling and give a little space without going into surgery. And so it's a great technique. It's not a cure for everybody as you're discussing, but he's probably at a point where if that one doesn't help, at least for several months, he's looking at some type of a surgery, whether he needs a disc to be shaved or removed altogether, or in kind of the more extreme case, which happens frequently, and that is a spinal fusion of 2 vertebrae so that the nerve space that's being pinched on now is blocked open. It can never be, narrowed again because you put a piece of bone in between the 2 bones.
We have about 2 minutes to go. We have a caller with us. Caller, you're up next. You're on the air with the doctor. Go ahead.
Yes, sir. I was in a VA clinic here about a month ago, and they were doing an exam for skin cancer, reoccurring skin cancer. And I got down to my feet and mentioned that I had claw toe.
Okay.
What is claw toe, and what can you do about it?
Claw toe and hammer toe are very similar type of scenarios where you either for your whole life you've been gripping with your toes as you walk. Kind of like if you put your hand flat on a table and then try to grip the table, you'll see your kind of middle knuckles come up off the table. That is like the toes have that same look where the knuckle comes up, but the tip of the toes are pushing down. And a true hammer toe is just the tip of the toes pushing down. But the problem is those joints become hardened in that position, and so it makes for painful or dysfunction of the foot in general. And so sometimes those have to be surgically altered again so that they lay flat. But that's what the claw toe is about. It doesn't if it doesn't hurt you, you know, a podiatrist would argue against me, but I would say if it's not causing you trouble, maybe it's something that doesn't need correcting right away. But orthotics sometimes will change the position of your foot. So a podiatrist would be a good choice to at least ask the question of, is there something I can do to prevent this from getting worse?
I want to thank him for the call. I know that I had issues where I had a knuckle on one of my big toes when I would go for long walks. It would sometimes hurt to the point where it made walking difficult. But I found a brand of shoes that I really liked, and I've been wearing them pretty much ever since. And it just seems that that particular brand has
Doesn't rub on that toe. Yeah.
right. And
Excellent.
so I go order those shoes every time I need a new pair, and it seems to do the trick. We've got to wrap up, but the contact information for anyone who didn't get in touch with you today, where would they get in touch with you
Yeah,
the rest of the week?
let's do the phone number. It's area code 208 933 4400. That's 933 4400. And always taking new patients, and love to see the grandkids if you're the grandparents listening.
I want to thank Dr. Jonathan Tripp for joining us in studio this
Oh,
morning on Better
w-
Health with Tripp Family Medicine.
One last plug. End of April, we'll be instituting immunizations again in our office. So, mentioning the little kids, it'll be a one-stop shop again.
Good to know. And we wanted to point out, too, the doctor's office is directly across from the main post office on Fillmore Street in Twin Falls. We've got a break for news from Fox in just a moment on KLIX.